So this video has been made especially because of lots of queries regarding what to be done in the last minute for Aims. Came up in my Telegram and WhatsApp group. Lots of calls also came regarding the same, and lots of people were even teary-eyed and crying regarding, and they were panicked regarding the Aims exam. So that's why I immediately made this video for you. So what to be done? So as you know, the final days of your journey to this prestigious institution for working as a DM neurology resident is here. And you needn't panic. You should take all this negative energy of panic, anxiety, etc. into positive way and start preparing positively. You have come up a long way, and you know that you know within your mind that you have done your best. So you have enjoyed your path, and don't just worry about the reward. You know that you are a wiser person now. From this moment, you just do one thing: write down that you already are working in Aims as a first year neuro DM resident, just to make sure that your plan is clear. Or you can write on the wall of your study room or on the notebook, your revision notebook regarding the same. And don't lose this opportunity. When you get your admit card, whatever happens, attempt for sure. Don't think that you are actually not made for Aims, or Aims is out of your league, and so prevent you from attempting the Aims exam. And make sure you take leave from work at least 4 to 5 days prior the Aims exam, and make sure you give your full attempt, get a focused MCQ into a focused MCQ solving mode, and prepare for the Aims, and have a timetable for the last few days. So as any exam, the pattern of Aims exam is 80 questions, 90 minutes, and you know that the correct answer will fetch you 1 mark, and the wrong answer will make you lose 1/3 mark, and unattempted will be a 0 mark. So make sure you cannot go for wild guesses. So the pattern of how to solve an MCQ I'll tell you in the next video. This is just for motivating you. And the habits which I'll tell you to suggest. So any habit to form within yourself takes actually 21 days. So this video is just a 4 to 5 days to the Aims exam. So but even then you can start building this habit. So channel your energy, as told earlier, to stop worrying and keep studying. You have started your studies, continue. No distraction should make you stop studying, especially this panic and anxiety at the last stage. And sleep should be adequate. At least 6 hours of sleep should be there. Adequate quality sleep should be there. And those people who are night people, and those who are morning people, whatever they be, you should make a habit to wake up at 6 a.m. whatever it be, because you know that the Aims exam usually occurs at about 9 a.m. in the morning, and it extends up to about 10:30. That is a 90-minute exam. So you should train your mind every day in such a way that this 90 minutes, this 9 a.m. to 10:30 a.m. Is the time for our brain to have a rigorous exercise to give its full extent to apply for the Aims exam or any exam as such. So 6 a.m. you wake up, breakfast at 7:30, get set ready and go by 8 a.m. as your exam is by 9 a.m. So that is by 8 to 9 you revise some old portions in your revision book, and get in front of your laptop to solve mock exams or any exams in the books or anything by 9 a.m. and make sure that the next 90 minutes, that is 9 a.m. to 10:30 a.m. is continued or spent straight in solving MCQs without fail in a exam simulating atmosphere. So this is actually an exercise you should do at the earliest. From tomorrow onwards, do that. And this will help you a lot, especially in the exams. So if you go on sleeping at this time, or doing some extra work or do other works during this time, your mind will be trained in such a way that you will lose that time for that. And your mind won't work that efficiently during your exam time, that is 9 to 10:30 a.m. And sleep at least at 10 p.m. So what to read during this time? The funda is, don't waste your time, whatever you read, and read your notes properly whenever you feel bored. That is, rest of the time mostly should be spent solving MCQs, and you can go read in a way such that when you solve the MCQs, you may go wrong in solving the MCQs. But that is natural, especially in the end of the exams, when the exams are near. So get back to these MCQs where you have gone wrong. Go to the theory part and solve questions. And also you have to read new things, because new things you cannot finish everything, cannot be finished in any exam. So go and read new things. So some things needs to be emphasized, that is last minute reads. Especially these last minute reads are highly volatile things which you cannot remember. So apart from the concepts, what you need to learn in the last minute would be the stroke, multiple sclerosis, muscle disorder. These are all subjects which are actually in institutes which happens to be the super specialties. That is the postdoctoral fellowships. That is in stroke, emphasize on the trials, dosages of the newer drugs, etc. And also in multiple sclerosis, various criteria of multiple sclerosis, NMO, MOG, etc., the latest drugs and their trials. Muscle disorders, the newer drugs. Then hyperkinetic and hypokinetic movement disorders, their adverse effects specifically concentrate on that. Anti-epileptic medications, and the new kid in the block, the pediatric neurology. Divide it as development, read a few things about development, one table from Nelson or any MCQ book. Milestones, that is development milestones, storage disorders, specific enzymes, leukodystrophies, etc. And you can see that especially in every learning module you must have come across all these. So go through this. If you are not thorough with that, go back and just revise through these portions or go through that module. About the biostatistics part, you should not miss this part in case of Aims exam. Because some exams of Aims, if you see the pattern, if you see the past 6 Aims papers, biostatistics have got a relevant portion in the most of the exam, except a few they have missed to add few questions in biostatistics. So you cannot study A to Z of biostatistics, but basic things you know, that is sensitivity, specificity, etc. you know. But biostatistics, what they emphasize is, or what they want is actually the trial part of biostatistics, especially in neurology. So basic things, what they would expect you to know is the number needed to treat, the odds ratio, relative risk, the positive predictive value, the negative predictive value, etc., which you can study from the necessary books, that is the PSM, that is community medicine books. So that is regarding the summary of the books to, or the things to read during the last minute. So checklist would be, as any exam, keep your admit card ready in print. There is 2 copies, and prior knowledge of the center would be very much necessary, especially during this pandemic stricken period, because Aims admit card has not been out till now at this point of time. That is and avoid last minute rush. So get a connection of friends. You shouldn't miss any communication. So you know that your friend, whether your friend has got the admit card or not, whether the friend has knowledge of the center and not. So get a good communication with your friend. Pray and meditate before your exam, and never panic, because you already have your MD medicine and pediatrics and a family to fall back on. So seeing a question paper, first to 10 questions you are not aware and very tough, you shouldn't go for a panic mode and falter during the exam. You should know that the pattern of exam, each computer, it's actually computer generated and it's randomized. So you have nothing to lose if the first 10 questions are very difficult. Next few questions will be easy for you. So usually the pattern of question is planned in such a way that if it is 80 question, about 15 to 20 questions would be very tough, and 15 to 20 questions would be very easy, and the rest would be in between these 2 values. So you should know that because it's randomization, sometimes you may be unlucky that the few questions of tough questions would come to you in the first go. So make sure that you in the first go continuously go through each questions and mark whatever questions you know in the first go. That is maybe the one-liners or the concepts you are very clear in the first go, and then come back and answer it. The way how to solve the MCQs is a different ball game, and I'll tell you how to solve the MCQs in the next video, because it's a detailed explanation which I'll give you. And keep your mind cool. That will definitely boost your performance. So just know that you have your basic and also the specialty degree with you, and super specialty just as an add-on. So don't panic. You have everything with you and everything is under control. Make sure you take leave at least 4 to 5 days prior if possible, and completely immersed in your MCQ solving mode. I have also conducted an MCQ exam and it's going on. You can join that, or any MCQ MCQ exams or MCQ books you can follow, and they make the brain exercise just before the exam. That is the most what is needed. All the best to all of you. Make sure you write the exam and stay safe during this corona pandemic period, and write your exam well.